everyone, and good afternoon. Welcome to our webinar, How to Prioritize Mental Health on College Campuses Through Technology. My name is Bryn Burgess, and I'm going to be moderating today's webinar. If you have any technical difficulties or have any questions during the session, please let me know just by typing into the chat box on the control panel on the right-hand side of your screen. Today, we are providing closed captioning for the event via stream test. If you would like to access this, click on the link provided in the chat panel or the link that you see here on your screen, and you will see the closed captioning. A core strategy to our rigorous curriculum development approach includes engaging both internal and external subject matter experts. And I'm pleased that today we'll have the chance to hear from both Erin McClintock and Dr. Alan Dennington. Erin is our, at EVERFI, Vice President of Community Engagement and Impact Education. She leads EVERFI's work in mental health and well-being and social emotional learning. And Dr. Dennington is the Chief Medical Officer and co-founder of TimelyMD. As the co-founder, he strongly believes in telemedicine's ability to transform healthcare and delivery for patients. Once we hear from both of our speakers today, we're going to open it up for Q&A. And with that, Erin, I'll turn it over to you.
Awesome. Thanks so much, Bryn. And thank you so much, Dr. Dennington, for being here with us today. We're really excited to be here. We're grateful for everyone who's taken some time out of your day to join us. And so just to sort of set up expectations for what this webinar is going to consist of, we're going to start with just a few slides to highlight the landscape of student mental health right now. Some of the specific things that we've seen as a result of the COVID-19 pandemic, some anticipation for what schools might see as they start to think about returning students to campus this fall, and of course the economic impact of mental wellness. Then I'm really excited to be able to engage in some dialogue with Dr. Dennington. As Bryn said, we are going to be taking questions at the end, so please don't hesitate to chat in your questions, chat in your thoughts. We welcome hearing them. If you have insights or case studies or examples that you're using at your particular institution or within your organization, we welcome you to share those as well. Moving to the next slide. Wanted to open with some data that looks at student mental health. You know, we're in a space where vaccines have started to roll out and they're demonstrating their effectiveness. The world itself has started to reopen, and many colleges and universities, if not all, have been doing a lot of thinking about what it means to welcome in a new cohort of students, as well as returning students for whom this academic year is going to look really different than the last academic year. Now, as we do this, it remains critically important to think about what students have collectively experienced, what we as a society have collectively experienced, and what post-pandemic student life is going to look like. And we all know that collectively as a society, we've experienced significant stress and what some would even refer to as collective trauma. And data reflects that. So the data that you see on the screen is from a data set of about 30,000 students, and it was collected between the May of 2020 and May of 2021. And we see that nearly 50% of students reported that the COVID-19 pandemic had a negative or a very negative impact on their quality of life. We see that 60% reported that it had a negative or very negative impact on their quality of education. We see almost 70% said that it had a negative or very negative impact on their overall college experience, and more than half report that it's had a negative impact on their mental health. Yet despite this, if you click one more time, Bryn, we see that there are some positives. So for instance, among more than half of students, despite the fact that they experienced significant challenges related to the value of their college experience, their opinion of their institution didn't change. And for nearly 20%, it actually improved. So Dr. Dennington, would love your thoughts on some of the data that we see on the screen.
Yeah, when I look at the data here, it's really not surprising, right, that people are saying COVID had a negative impact on their mental health and on their education. You think about students missing out on big life issues, high school graduation, even when they're in high school, then going into their freshman year and being remote or not getting to make those connections that they would have been excited about. One of the things we hear from a lot of our campus partners, one of the #1 issues they say that their students struggle with is with loneliness and isolation. And going into your freshman year and not being able to connect to people is only going to kind of exacerbate that. So you see that there's likely going to be impacts on quality of life and their, the perspective of how their school experience went. TimelyMD, our company, did a survey of about 1,200 college students that we work with, and 82% of those reported even after a year into COVID, this is in March of 2021, that they were continuing to have increased stress and anxiety related to COVID. And then another 75% of them said that the impact on the quality of their education has affected their mental health. So we see a lot of similar data kind of in the survey that we did as well. And so I don't think this is surprising to see.
No, not surprising at all, and certainly top of mind for most schools as they're thinking about what is the fall going to look like. Interestingly, if we go to the next slide, we see this play out among data related to college presidents as well. So since April of 2020, the American Council on Education has actually been collecting data, surveying college and university presidents in order to understand how they're adapting and how they're responding to some of the challenges that have been presented by COVID-19. So in the April of 2021 spring term survey, that's what the data on the screen refers to. When presidents were presented with 20 issues in today's landscape, the mental health of students was the most pressing issue that they identified. This was also the case in November of last year, so it remains the most pressing issue. We also see more of an intersectional lens to mental health. So recognizing that 55%, more than half of presidents indicated that their campus DEI efforts also included initiatives that support the mental health of historically underrepresented students. And then over half of all presidents, 52%, also indicated that their budget to support student mental health and faculty and staff mental health, which was one of the other top pressing issues, had also increased for the upcoming academic year. So as we take into account both these inputs and the inputs that we shared on the previous slide, it's really important, and we invite you as we go through this webinar to think about what is a post-COVID educational experience going to look like? How can we build upon this momentum and continue to use the experiences of the past year to make our communities even stronger, and also anticipate some of the needs, both known and unknown, that students are going to have when they come back into our campus communities. Dr. Dennington, I know for sure you have some thoughts on this slide as well.
Yeah, absolutely. Very similar to the data you're presenting here, Inside Higher Ed had done a survey as well that showed student mental health being a top priority among college presidents. So 96% of the college presidents expressed concern over student mental health as making it the #1 issue amongst college presidents on that survey.
Fascinating stuff. It's interesting to think about as you consider the fact that college presidents are now paying attention to this issue. It really has moved from being kind of in the shadows where you're having to fight tooth and nail for resources to now being in a position of thinking about, okay, what exactly do we want to use to prioritize our funding and resources? And we'll talk about that in just a couple of slides. But as we finally start to move past the immediacy of the pandemic and into what many are calling a reintegration period or a return to normal period, which there really isn't going to be a normal after this, right? We're all going to have to adapt. There's likely going to be new challenges that will emerge. So for some, this is likely to include increased anxiety, both about going back into public, about how to act in social settings, about being back in crowded spaces. Do I wear my mask? Do I not wear my mask? Others are, others aren't, without those sort of set rules. Lots of decision making on the part of students and many of us professionals. We may also see decreased attention spans among our students. Many of them have been learning virtually, and it's very easy for those of us who have been working remote, we know this, to toggle between looking at things on your screen, looking at your phone, and moving between tabs. That's very different than what students experience when they're sitting in a classroom. And so there may have to be some reintegration around how do we learn in a classroom setting. Additionally, for many students who are attending college for the first time, the typical challenges that we can expect from them may also be amplified and exacerbated by the unusual experience that many have had in their last year of high school. At EVERFI, we provide mental health education for students both at the high school level and the college level, and some of what we're seeing around incoming college students is really interesting. We see almost half are more concerned about their mental well-being. We also see them concerned about their academic preparedness, their finances, and their degrees of social connectedness or isolation. So as we think about the importance of prioritizing mental health in the post-COVID world, it's also important to focus on holistic well-being. How are we supporting all of the needs that students have beyond just their mental health, but their physical health, their social interactions, their academics, and their finances as it relates to their return to school? Dr. Dennington, other perspectives on this?
Yeah, when you look at this chart, again, I feel like a lot of this makes a lot of sense for the students. So you're talking about increased anxiety. Students are having to go back and they're starting over again, right? They may have had friends they haven't seen for a year. They may be going into college really for the first time, having missed their freshman year. So they're kind of starting over again and meeting new people and trying to learn how to navigate what's really kind of become a new world as far as physical space and other things like that. But on top of that, they're dealing with that the mental issues that go along with that, the pressure of, it's not so much the physical anxiety, I don't think, for students. It's if I wear the mask, am I going to feel like I'm out of place doing that? And these kind of pressures that they may have in that setting. Again, you have here a focus on holistic well-being, and I think that's something that's really important for students, because as we get students to access healthcare earlier on and think about well-being as a whole and not just treating people when they get sick, that's where we start to see improvement in preventing them from getting to the point where they're having a bad outcome. So we really want to look at how do we prevent students from having bad outcomes by preventative measures, so focusing on that holistic well-being.
That's a great point, and that's a great tee up for this slide. So one way that many institutions have started to think about student mental health and well-being is through a matrix model. So historically, there's often been a trend to focus resources exclusively on students who are struggling with their mental health, whether that's in the form of counseling resources, staff, etc. And obviously that is a critical area of focus, but there's also factors within the built environment that can contribute to bolstering community-wide well-being, both as an antidote to illness, but more importantly, as a mechanism for creating environments in which all students can thrive. And I think after the past year, that might be more true than ever. So one model that I really appreciate as a depiction of this is adapted from the work of Corey Keyes, and that's what you're seeing on the slide here. So for instance, you may have a student who lies at the spectrum of having a diagnosis of a serious mental illness. So that's what you see at the top on the left side, but still may be able to achieve optimum mental health, mental well-being, because of positive and healthy practices that they engage in, because they have supports, they have a community, they have resources in their life, they have access to good quality care, a loving and caring support system, and the skills that they need to be able to seek out help and prioritize their well-being and do things that they know will bolster it. But at the same time, you may have another student who has no diagnosis of mental illness, but still may experience mental well-being for the opposite reason. They may not have a strong support system. They may not have language to express how they feel. They may not have access to resources. They may not have a sense of purpose or a sense of community. And so as we're considering our efforts to support our students within our communities, it's really important to think about the wide range of where students sit and how we can design our resources with the ultimate objective in mind, being how can we create environments where all students, regardless of a diagnosis, can thrive. And additionally, we know that the prioritization of mental health and wellness is not just about supporting students, right? It's not just about how does this benefit students, but it can benefit our institutions directly as well. So for instance, consider this. The average yearly tuition, room and board is $23,000 for college. And we know that students with a mental health condition are twice as likely to leave an institution without graduating. Now, research from the Healthy Minds Network, and they have a fantastic ROI calculator that we can drop a link into, has found that an investment of just $20,000 into prevention related to student mental health can retain 300 students and yield $3.1 million in tuition revenue. So investing $3,000 less than the average room and board of just one student can have the potential to retain 300. Dr. Dennington, I know you have some additional insights on this topic.
Yeah, absolutely. So if you'll go back to that previous slide real quick, I wanted to talk about that when we were on there. That National Alliance of Mental Illness did a survey that showed 64% of dropouts cited mental health reasons, as the reason that they are no longer in school. And then out of those students, 50% of those students, which is 32% or a third of all the dropouts that they surveyed, said they didn't access any resources at the school prior to dropping out. So in that survey, you can quote that survey. I have a quote here. It says, since the graduation rates are a key factor in ranking colleges according to the closely followed U.S. News report on colleges, providing adequate college mental health services is a good investment of resources. So they said, what are two things to those students that might have helped you to stay in, what are things that might have helped you to stay in school? And two of the highest listed requirements or things that the students reported was, one, accessing mental health services and supports on campus to help them address mental health issues impacting their academic performance. And then two, connecting with mental health providers earlier. So again, like we talked about, that preventive, holistic approach of connecting with people earlier. So what that really leads me to is that next slide that you have to show, which is Timely. We did a survey again of our students after follow-up care. So on this next slide, you'll see that on that survey of the students, if they didn't have telehealth services available, that 68% of those students who were surveyed said they would have done nothing. Now, when you take that and you compare that they would have done nothing, but instead they did access care, right? That these students access care, and then you match that up to that National Alliance on Mental Illness statistics that of all the students they surveyed that dropped out, 32% of those students said that they dropped out for mental health reasons and that they never accessed resources on campus. It becomes evident that in a lot of ways, the resources that are there for the students, it's not they don't have them, but they're not accessing those resources. And telehealth is a resource that people who would normally do nothing will access. So I think that's pretty relevant data.
I'd say so. And I think that's part of why Timely and EVERFI have partnered, right? To focus on supporting the mental health of all students and making it easy for institutions to do so. So one of the things that we know, and this slide alludes to, is that there are a variety of different experiences, beliefs, and opportunities as it relates to student mental health, and that not every student is the same. As such, the same approaches may not work for every student. So this spectrum that you see on the screen highlights the Institute of Medicine's Continuum of Care, which is really focused on all of the things that are important to consider as it relates to student mental health. Now, for the past 12 years, EVERFI has focused our efforts primarily in the prevention piece, empowering all students with shared language to communicate about topics related to well-being, providing them with critical skills for coping, and a shared commitment to reducing stigma while also encouraging those in need to seek help. This is crucial because it helps raise awareness, it helps increase knowledge, and it creates opportunities to recognize the role that they can play in supporting their mental health as well as that of others. But it's important to provide opportunities for students across the spectrum to have access to preventative information on how to support themselves during trying times, what kinds of resources are available, and how they can leverage their own strengths to confront the challenges that they may face. But of course, this is just one aspect of supporting student mental health. And it's just as important, especially now, especially as we're thinking about welcoming students back into a school community, to be able to create opportunities to identify students maybe struggling and to guide them on a path to getting treatment. So this is where TimelyMD comes in. And this is why this is such a brilliant partnership. Don't know if you want to talk a little bit more about Timely and the great work that you all do, Alan.
Absolutely. And I think this slide in the continuum of care is a really important part of what we do and what EVERFI does, and I think what makes the partnership that we have together so important. And it's because what we're doing is we're lowering the barrier to entry and making this big, broad front door for students to be able to access services. So a goal when you're triaging or trying to get people to access services is to get them to the right level of care at the right time. So we don't want people that have a cold going into the emergency room, right? The expense is too high. It's costly, it's cumbersome, it's not an efficient use of our resources. In the same way, if students can access EVERFI information and do self-treatment or take that first step in care, then they're leading more towards prevention and early identification of illness and early treatment, which may prevent it from escalating into those further categories. If they don't have that access, right, they don't have that some easy way to get into it or something that's kind of a low barrier to entry, that same student's not likely to walk across campus and walk into the counseling center to look for something when they feel like their issue they have is small. And maybe it is small then, but small issues are the ones that grow into the bigger issues. So lowering that barrier to entry and being able to access a mental health provider early on and talk about anything, talk about the breakup that you had with your boyfriend or your girlfriend or your significant other, being able to talk about it then so that it doesn't escalate or cause you to start missing tests or have you start feeling more depression, start having you see poor success in school. That leads to your scholarship having issues, then your scholarship issues lead, we get so far down that spectrum or that continuum of care before they finally walk into the counseling center that it's almost too late or we're having to dedicate a lot of resource to this one student to pull them back to being normal. And then the center's so busy dealing with all these high acuity issues that they don't have as much room necessarily for the lower acuity things to come in. If they do try to come in, that's the appointment, you can't get an appointment for a couple of weeks, or these other things they don't have a resource available to them, and then they can't get in until they've escalated to the point where it becomes significant. So that prevention, getting people to the right level of care on the continuum of care, is really what EVERFI is about, and also timely in being able to access care kind of right away, even from small things all the way up through bigger things.
Absolutely. And I think in the past, schools have often been in the position of needing to either provide those upstream resources for students or provide resources for students who are in the most need, both of which are important for creating a healthy community in which, to the point we made earlier, all students can thrive. And a huge part of this partnership is that they can do both when they work with us together.
Absolutely.
Going to the next slide. This really summarizes both of our distinct approaches to how we work together. So EVERFI as an organization provides prevention education focused on meeting all students, casting a wide net as possible, helping to identify those who might be in times of need and encourage them to seek out help, empowering all students with coping skills that they may need to support themselves or one another. And then through a partnership with Timely, we're able to then direct those students who need care to seek out support from on-demand medical professionals, whether it's mental health or also physical health, correct, Alan?
Yeah, that's right. So at Timely, we create customized telemedicine programs, telehealth programs for institutions. So we work with whatever existing resources are available on campus, and we supplement those to enhance the offerings that you have, so that to bring 24/7 access to care to your students. So we work on both mental health and medical health, doing both on-demand appointments and then scheduled counseling appointments for ongoing therapy needs. But also that on-demand mental health is an important component, because that is that low barrier to entry. Talk to us about anything. In that program we call Talk Now, because that's what it is. It's call and talk to somebody when you need somebody to talk to. So it is this continuum of care, and getting in the front door, having access to care, and then being able to partner with the on-campus resources to help get the student to the right level of care and make sure that they're getting to talk to somebody, and we're addressing those things as early as possible.
Absolutely. So with that, excited to bring Bryn back onto the stage and engage in some discussion.
Great. Thank you so much for setting the stage there a little bit and walking us through what we've been seeing on college campuses so far over the last year and a half. Would like to dive in a little bit into some discussion questions and hear from both of you. And the first question that we have today are, what are some of the biggest issues the mental health field on college campuses are facing today? Those counselors, what are they seeing in the space? And really, what are those overarching trends?
I would say the biggest issues that colleges are reporting, seeing to us are loneliness and isolation, kind of coupled with depression and anxiety. That students, even when they have connections on campus and friend groups and things like that, because of social media, other things, they feel like even though they're connected, they feel like they're alone, and so they report that loneliness and lack of connectedness. They want to feel like they're a part of something bigger. There's also a lot of social issues going on right now, and that plays into that a lot as well, both with race-related issues, politics. There's just a lot of differing feelings and a lot of stress and anxiety in the air right now. I think that plays into it a lot as well.
Absolutely. I'd agree with those. I think also, having been a clinician on a college counseling center, granted it was over 5 years ago, I think one of the things that is just an eternal battle that we face is challenges with resources, right, and resource constraints. I think those tend to remain a constant. I'm optimistic about the fact that more than half of college presidents report that they have allocated more funding to mental health. I think this is a topic that students are demanding resources on. Staff, faculty, everyone is recognizing the importance of, but it continues to be a challenge. And I think the more that we can empower individuals to be able to assert the economic benefits of investment in mental health, the more important it's going to be. I also think another thing that we're seeing and we're hearing is a true need for diversity and for cultural competency among counseling center staff. I think that this is becoming a growing demand among students. I think that it's becoming, not that it hasn't always been, but an increasingly more important priority and one that's on the radar of college presidents and counseling center directors alike. I was recently reading through the data from the Trevor Project. With this being Pride Month, they released their 2021 survey of LGBTQ youth, and 70% stated that their mental health was poor most or all of the time during COVID-19. Almost half, 42%, seriously considered attempting suicide within the past year. And what was most alarming to me was that almost half, 48%, wanted counseling but did not receive it. And so as we continue to think about how are we welcoming students back into our communities, when we're thinking about those students who may be most in need of care or most want care, how are we ensuring that our staff are trained in a culturally competent and hopefully a diverse representation of staff within our ranks?
And I think those two things that you mentioned too play off of one another, right? If you have these budgetary constraints, but you're looking to have this diverse pool of counselors available, like how do you match those things up? You can't, it's hard to make your counseling employees, on your campus have the same kind of diversity that your student body has, because the student body is incredibly diverse and there's just a lot more of them, right? So how many counselors do you need to have in the counseling center to try to match up to that diversity, have that available? And that's one of the benefits too to having some sort of partner organization like EVERFI or Timely, where you have this access to a much more diverse or broader group of counselors that you couldn't necessarily have as employees within your own institution, but you can have access to those different types of counselors and those different diverse perspectives and skill sets for your student body to access.
That's a great point.
That's incredibly interesting. And I'm glad you brought up the capacity issue, because I think that's something that we're seeing across the board. And leads us really nicely into our next question. And that's really just around, what are some of the more hidden benefits of using technology to scale your mental wellness efforts on campus?
Well, I think part of it is what I just mentioned, right? That you have this access to a broader pool of providers. So in terms of diversity, but also in terms of licensing. So if your students are remote, especially now after COVID, so many more students are at home, or there's going to be more virtual learning opportunities, and colleges are going to have to present more virtual learning opportunities for students. And when they're remote, how do they access care? Do you have providers that are licensed in those states to access? So there's certainly a benefit there on being able to scale and being able to have students see somebody that they feel like they have a connection with, and that's also licensed appropriately, with the state where the student is. There's also a lot of flexibility in scheduling. Like, it's hard to keep your campus counseling center open 24 hours a day, 7 days a week, or people on call, or to have appointments for students when they're looking for them. Students have class a lot of times all during the day. So how do they get an appointment at 3 o'clock when they have their lab then, or whatever else it may be? So having appointments available in the evening, 6, 7 o'clock, may not be something that's easy to do within your campus and within an on-site campus counseling center. So having that technology to be able to have flexibility to scheduling. And then the last one, I think, is just eliminating stigma. So students walking across campus, walking into the building is a barrier to some students going in. Like, they don't want to do that. They feel like they'll be judged for that. As a matter of fact, I talked about the NAMI survey before, but the #1 barrier to lack of engagement to mental health services was the fear of stigma. So 36% of students said that they wouldn't seek counseling because they were afraid of what people might think. And so with technology, you really lower that barrier, enable people to do it from the privacy of their homes, their rooms, where people don't have to know that they're doing it, and be that first point of entry. Same with EVERFI's content, right? Being able to access that information, that data, and start to self-treat. It's taking that first baby step that then leads to the next step, that leads to the next step, that gets the people in the door.
Absolutely. I couldn't agree more. And I think, just putting an exclamation point in that ability to reach all students. I think that when we, as well-intentioned as we are, and there's certainly, this is not to say that the programs that we create in-house are not important. They absolutely are. But I think there's a challenge in being able to reach all students when you're doing in-person programming or solely programming that's focused on small subsets of the student population. And I think with technology, you're able to scale it. You're able to cast a wider net to reach students with information that they may not otherwise have access to. And it's not just those students who are most likely to engage with events when you hold them, but commuter students whose schedules, to your point, Dr. Dennington, fall outside of the traditional counseling center hours or the traditional programmatic schedule, students with children. really thinking about how can we cast as wide of a net as we possibly can, and technology does allow us to do that. I think a second piece is data. When you're using, regardless of what technology program you're using, data should be a critical component of it. And when you're able to cast that wide net, you're able to get data inputs that you may not otherwise be able to have through student surveys or through pop-up surveys at events. And then I think the final piece is not viewing technology as in opposition of person power, but how can technological efforts support the in-person work that's being done? I think sometimes there can be a tendency to have this conversation. And I know when I entered, when I made the leap over to the dark side from the clinical world to the tech world, it's obviously not the dark side, but one of the things that I was really insecure about was, well, is it a competitor? What's it like? And I think that it's really important to recognize that good technology should only serve to bolster and enhance the in-person one-to-one connection work that's being done among the millions of amazing college counselors, wellness directors that are out there that we get the privilege of partnering with.
Absolutely. And I think, just like you said, it's getting people to the right level of care at the right time. So it's all part of that continuum of care. There's always an important aspect to having that on-campus, in-person, service available, but we make it more effective and we get the right students to that service when we have the other services available to help relieve pressure from them so they can see the students they need to see in the counseling center, and the students that are better served or that might access care only through a different means can do it through technology.
That's super fascinating. Dr. Dunnington, our next question is for you specifically, and about reaching that diverse student population. Are you noticing any differences in gender, race, or ethnicity disparity between students seeking help on campus versus those who are seeking help via teletherapy?
Well, I love that Aaron mentioned data earlier, and that's one of the things that we're actually working on as an organization, is gathering data around how does that utilization and how do success metrics look for minority populations or marginalized populations, utilizing services. We do see in our data, that males tend to use mental health services in general less often than females do. That's kind of both in person and through telehealth. So it's how do we start to reach those populations? But it's also been seen, that minority populations tend to seek care less often, despite the fact they have similar rates of illness. And so there's a question on why is that? And the really the leading thought there is around stigma, that there's more stigma within the communities there around seeking help for mental health issues, that they're not going to have the same support necessarily if they do that, or that there's more of a hesitancy to do so. And so, having telehealth or a technology service available, again, helps to lower that stigma and that barrier, and helps to hopefully bring a more equitable solution, right? It doesn't have, there's lower costs, so you eliminate these cost barriers on cost to access care, and then also start to eliminate that stigma around somebody seeing that you're doing, or be able to take that first step.
Absolutely. All right, our next question is for both of you. What outcomes do you see this partnership bringing to the table for students and for counselors?
Well, I'm glad to go for it. We've talked about it a little bit, but filling out that continuum of care. So where EVERFI is, again, a great starting resource, but then being able to refer to an in-person or a resource where somebody can actually talk and receive care from a certified or licensed mental health professional. And then from there, being able to go into the on-site counseling center when they need it. So it's filling out that whole spectrum of care for an institution, or we're coming in and filling in any of the gaps that might be present on the campus. So I think that's, we're lowering barrier to entry and then making that first step easier. So the first step, is not to be too cliche, I guess, but the first step is the hardest one to take. If you can get a student to take that first little step, the first baby step towards wellness and looking at something, well, that might lower the barrier to them saying, okay, I'm going to take the next step to go ahead and talk to somebody on the phone, and then I'm going to take the next step to eventually going into the counseling center, right? But they're going into care, they're getting help when they need it, and not just dropping out.
Yep, I agree. I'd say ultimate goal is more students reached. The more students we can impact with the topic of mental health, whether it is giving them access to the information they need to help a friend or to help themselves, or getting them connected with a counselor, that they otherwise wouldn't meet up with, the better. And that's the ultimate goal for all of us, and I'm sure the schools we partner with as well. I think alongside that, it's fewer students slipping through the cracks. So I often use the example of when I was a clinician. I had two different types of students that I often call to mind when I do this work. And the first are the students that would come in during the first week of school that were talking to me about how stressed they felt and that college wasn't what it was supposed to be. And they wondered if something was wrong with them because they weren't having the experience that they thought they should, but they had great friend groups, they were doing well academically. And generally, those students really benefited from some basic coping skills, some acknowledgement that what they were experiencing was a typical part of many students' experience, and some validation. But then I had other students that would often come in and they would sit down, maybe 2 weeks left in the semester, and they had come to my office at the encouragement of a friend or a family member. They had started to withdraw academically, they'd withdrawn socially, they were in jeopardy of failing out of their classes. And for those students, my thought was always, I'm so happy you're here, but I wish that we could have gotten you the support sooner. And so I think about both of those students in terms of how do we reach both of those students at a time when it's going to be valuable to them. And then I think the third benefit is really like the third outcome that I'd love to see is more of a focus for staff, more time for staff to really be able to focus their efforts on things that bring them excitement, things that are complementary to the work that our organizations are collectively doing, and how our organization's data can empower them to do that in a really smart and scalable way.
All great answers. Thank you. And with that, I'm going to open it up to some questions from our audience. So our first question that has come in is, what resources or strategies are available for colleges to offer students who are seeking in-person counseling opportunities aside from a counseling center, as we start transitioning away from online engagement and students continue to express interest in in-person interaction rather than virtual? Erin, do you want to take that one?
Yeah, I've got some ideas, and I'd love your thoughts too, Dr. Dennington. I think one of the things that is going to be really interesting about this sort of reintegration of the new experience of students is, how do we mitigate and work through some of the social isolation that students have experienced, while also helping them to reintegrate in a way that feels comfortable for them and safe. And so one idea that comes to mind is, how do we leverage the power of peer-to-peer connection to support those students who maybe are not, at an acute risk or experiencing significant mental health challenges, but rather are experiencing some anxiety or some loneliness or some feelings of isolation, using peers to connect peers with one another. So I think it'll be interesting to see if perhaps students are more open to groups because they have been so isolated for the past year or so. I think this is also another opportunity for a triage approach, which is what we see a lot of schools starting to move towards, which is, rather than, to the point that Dr. Dennington made earlier, a student calling or emailing the counseling center, having to wait 2 weeks to get an intake appointment, having set blocks of time throughout the week where there's, a 15-minute screening conversation with a professional, whether that's a counselor or sometimes it's even, a clinically supervised intern, to ask specific questions to understand, okay, what is it that this student needs? Is it that they need some coping skills and someone to listen, or is it that they are really, in crisis and they need a higher level of care? And then working to be creative around how they're scheduled in. Or perhaps that's a great opportunity for Timely, right? To be able to work, okay, here we've got this great resource in the form of TimelyMD. Here's how you could connect to someone through that. But I think that creativity is going to be a fun part of how we're thinking about the past. It's something we've had to apply over the past year, and I think that it's something that we should continue to bring with us into how we're approaching the back to school season.
Yeah, I agree. I think, it's data is interesting when it comes to telecounseling at times, in that most students who utilize telecounseling have a very favorable experience, and report that they liked it. At the same time, you can do survey data that says people prefer in person. If you go talk to clinicians though as well, even a year or two ago, as you're talking to schools about if they preferred as a clinician being in person or being virtual, they would have all said that they preferred being in person, and they were, kind of suspicious to some extent about telecounseling. But after having done it for a year through COVID and having experienced it and experienced how they can build that therapeutic relationship, those perspectives are all very different. The counselors now, many counselors say that they very much enjoy being able to do telecounseling and the reach that it gives them. They feel like they build the same connections with students. And I think over time, students may, will see some of the same benefits, through telecounseling. But I do think Aaron had a lot of great points on how do you, I mean, that's a huge challenge. How do you expand in-person resources on your campus to the extent that demand is there? Well, the demand is so high. I mean, you can't go hire that many people. So how do you reach all these, these students? So group sessions, are one way to do it. Peer-to-peer, is another great idea. You can also look at creative ways around scheduling, like how do we space out here we know what our capacity is for in-person. How do we spread that out so more students have access to in-person counseling, and then maybe in between those sessions that are getting maybe spread out, then they can do some sort of virtual counseling or something where you have a broader access in between to help them get from one in-person counseling session to another. So maybe it's kind of a hybrid approach there to some extent around. We do have people that can get into in-person counseling, and if you need help in between, but that helps to expand the access that your students might have to in-person.
One other point I'll just add, and I can't believe I didn't think of this, but is so if a student's using mental well-being for students, which is EVERFI's population level course, one of the questions that we actually ask them is, are you interested in getting more involved with mental health promotion efforts within your school? And so if a school is using that resource, they'll get a list of students that have opted in to say, yes, I want to be more involved in mental health promotion. And I know at least when I was on a campus, that was my best asset, was the students that I could mobilize and empower and give the skills and support needed to go out and be kind of ambassadors for the topic of mental health. And so that's another great starting point if you have access to that data or another form of data to identify students who may want to help, may want to be a part of a peer-to-peer program or peer education or something similar.
I love that example of activating your student population to help scale the work that you're doing. Another question that we had come in that's kind of related to that is, how can institutions really show students that they are making these investments in their mental wellness and that they really care about these issues?
I think a lot of that is around how much focus do you put on it on your campus, right? Like what kind of marketing efforts, what kind of messaging are you giving through your social media accounts, other things like that around what resources they have available to them. So, through announcing those efforts, talking about mental health a lot, talking about it in your, in group settings, whenever you pull the student body together, on your social media channels, hey, remember when you have access to this service, remember that it's here for you, and trying to connect on their level. So I think it's about putting effort into awareness that there is an issue and that they have resources available, and that's something that's a priority to the school.
Absolutely. Put a huge exclamation point on that comment. One of the things that we spend a lot of time looking at in terms of EVERFI data is to what degree are schools communicating outwardly, publicly, and proactively about topics related to student health and wellness. And we've seen some really direct connections between those schools that are outwardly communicating on various topics and the positive behaviors that are happening related to those topics. So the more that the president is communicating, not just when something bad happens, but and not just within the context of orientation, but regularly about mental health, about student health, about well-being, the more that it's mentioned in your strategic plan, the more that it becomes a part of not just that, something bad happens and we have to talk about it, but rather we are weaving this through the fabric of how our institution operates, the better. Syllabus statements is another great way. Staff and faculty have started moving towards having statements in their syllabi that speak specifically to mental wellness and what resources are available. And I think that that's leading, and that's truly, what students are needing and wanting to see.
Great. Well, thank you so much for your very thoughtful responses to these questions today. It's been a really great conversation. Before we close it out, I'm just going to launch a quick poll just to gauge interest. If our attendees are interested in learning more about how their institution can partner with EVERFI and TimelyMD. So I'll leave this up for just a couple seconds as we wrap up. Please feel free to just answer yes or no on your screen. And I really just wanted to take this last moment to thank you all for attending this webinar today and engaging in this really critical discussion with us this afternoon. We hope you enjoyed the session. And I would also really like to thank our presenters for sharing their insights. For those who asked questions that we weren't able to get to today, we'll be in touch after the session and make sure we get you those answers. And we'll be sharing the slides and the video of today's conversations if you want to come back and revisit anything. So thank you again for joining us, and we look forward to having you attend future EVERFI webinars in the future. Thank you so much.
Thank you.
Thanks a lot.